Arisman, and I am Director of Alumni and Outreach for Azusa Pacific School of Nursing. And today I'm really excited to bring about an interview. We have David Benavides, who has been a part of our ELM entry-level master's program in San Diego. He is currently an NP student. He's been working as a nurse for about a year now. And we've got Leroy Villaria, who is kind of halfway through the TUG program, and he is curious to kind of find out what he needs to do and prepare for as a student. So our goal in Sun Alumni is just to support our nurses' journey. So before we go to anything else, I want to be sure to invite all of you to our nursing group online, apuconnect.com. It's exclusive to APU. Once you're online and vetted in the program, you can reach out to alumni just like David. There's information in their profile that says that these alumni have wanted to be involved in helping support and answer questions for people. You can use the search bar to find out people in different regional areas or specialties. And we put job postings from Handshake on there. So there's lots of benefits of this program, and I am your bridge. If you have any questions, you can reach out to me at sunalumni@apu.edu, and I'd love to answer your questions and connect you with cool alumni just like David. So Leroy, we're just going to hand this over to you to do your interview. So go to it.
Well, good morning, everyone. So, what kind of questions do you usually get in interviews, and like how can you like stand out in those types of questions, and like what kind of answers are they kind of looking for?
That's a great question, Leroy. Thanks for asking about job interviews. That's a very hot topic with new people coming out of the programs, especially around San Diego, where I'm located. It's very competitive getting new grad nursing jobs. So I'll tell you what worked for me, and I can't speak for everyone because everyone's story is just a little bit different. But for me, during my undergraduate nursing program, networking was huge. And just about every industry I've run across says it's not about what you know, it's about who you know. And I fully support that sentiment in undergraduate nursing interviews because everyone comes out of an undergraduate nursing program with the same license. You're supposed to all know the same things from the NCLEX, from QSIN competencies, and so forth. So when they look at you all on paper, generally you are going to have the same skill set. Sure, some of you might have an ALS or a PALS or some other type of work history, which is important. But as far as the nursing industry goes, you are all brand new. And so it becomes a factor of promoting what else you bring to the table. And part of that is interpersonal communication, i.e., your networking skills. Because even when you go to work as a nurse and hit the floor, you're going to meet 4 or 5 new people, new nurses you never met before who are floating, doctors that come through, new patients. And so those skills are very, very critical, I feel. So I spent a lot of time networking and getting to know people. And while you might not get a job with them, they are real nurses or healthcare professionals that will write you letters of recommendation if they like you. And so confidence is very important as you go out there into your clinicals. Talk to these people and say, hey, I'm going to be applying for a job soon. Don't be shy about it. They all know you're going to be doing it anyway. Say, I'm going to be applying for a job soon. What do I need to do to impress you to get a letter of recommendation when I'm done here in 16 weeks or 2 weeks or at the end of the day? Anything. And try to feature the skills that you're working on when you're with them. Say, this day I am working on changing central line dressings. I'm paying attention to safety. I'm paying attention to patient satisfaction. And then I'm going to go home and I'm going to review it and I'm going to come back and do it better next time. And when people see that kind of attitude, they want you on their team. They want to work with you. And that is so critically important for them to get an idea of your clinical skills. So if they can combine those two things, your professional communication skills and your clinical aptitude, or even just your willingness to improve your clinical aptitude, then you have a great contact. So that's number one in my mind, networking and getting to know people. I have clinical instructors who were working nurses that I still communicate with to this day. Don't let those relationships just drop off the text thread, on Thanksgiving. Text them and say, "Hey, I'm thankful that you were my clinical instructor," or shoot the unit manager an email on Thanksgiving. Like, don't be shy to reach out to those people, because if you say, "Hey, I'm going to reach out to you one day," and then you never do until it's time to get an interview or a letter, guess what? They're not going to give it to you. And so it's about building those relationships further than just like, "Hey, I want a job one day." So do that and network. Um, Beyond that, I would say that showing an interest in the field you are trying to go into is very important. So I myself want to do critical care nursing. Right now I do step down nursing. So I'm on my way and I'm having a great time along the journey. But when I talk to people and I ask them, okay, when I want to get into the area I want to get into, what do I need to do to be ready to go there? And that applies to anything. It could apply to emergency, pediatrics, population health, anything. And that's great because they see you have an interest in it. And then without a doubt, there are some additional steps you can take, right? So if you want to go into the ER, join the Emergency Nursing Association and start to talk to those people. They have certifications you can do. They have little webinars you can do. They have little classes you can do, workshops you can attend. You can get your ACLS. That's very important in emergency. And then when you build your resume, you have a lot of extra little tidbits to show, hey, not only am I interested in going into emergency, I also took additional steps and spent time to learn extra skills and learn about the field that I want to go into. Because you don't really know what it's like till you get there. Every kind of touch you can do into that specialty is important. And that applies for anything, population health, whatever you're going to do. Nextly, I would say you need to be a personable person for interviews. They will read your resume ahead of time. You don't have to spend a ton of time explaining it to them. Uh, or they're going to read it 5 minutes before you come into the room. But what they really care about is the impression that you leave on that room. And so you don't want to be too confident. You don't want to be arrogant. You want to be friendly. You want to ask a lot of questions. You want to be curious about them and their unit. And you want to show them that wherever you're at, you're going to add something as a human being, because we end up working elbow to elbow with these people every day in very stressful situations. And they need to know that beyond your skills, you have the capacity to work with other humans well. And so I would say that everything else, you're great. I had a great grade point average. Guess who cared? Nobody cared. They didn't give a crap about that. They didn't care where I went to school. They didn't care about, what other stuff what classes I took, what clinicals I did. They cared more about that other stuff. And I can say that with great certainty because I applied at pretty much every hospital down here.
Thank you so much for that. Because as someone really, really new, it's really like gaining the experience and gaining the wisdom of like someone who's been out there. It's really applicable to what I can do. Thank you so much for that. My next question would probably be going back to like how to juggle like nursing school classes because they can be really demanding with like also like starting as early as now to get that experience and like what do you suggest? How can that be done? And what was your like experience during nursing school and like trying to build like your extracurriculars?
It's very hard. And I think that in a lot of ways, when we go through nursing school, especially undergraduate nursing school, because it gets more relaxed, by the way, once you get to graduate level stuff, it's easier because I understand that you'll be working at that point. In undergraduate studies, they pretty much assume that the program is going to own your life. And in some ways, you kind of have to let it, right? So you're going to have difficult assignments. You're going to have a lot of studying to do, a lot of stuff to memorize, and a lot of places to be for clinicals. Sometimes at night, which is very difficult. One thing that I did that was very, very helpful for me is I went and I got a CNA job during school. But I was very clear with my manager. I said, I am in nursing school. That means you're getting a great employee. And when I'm here, I'm 100% here doing good work. But if something comes up with my school, I have to take that first. And if you set that precedent ahead of time with them, I think that they fully respect it. If you go in and say, I'm going to work full time here as a CNA and dedicate my life to whatever unit this is, then they expect you to do that at your workplace. And that's just not realistic. So I think if you can swing it, just work 1 day a week, do an 8 hour shift somewhere if you can. And the important thing about that is if you don't already have hands-on patient care experience, which I didn't, then they know, and you get a letter of reference from your manager where you get that job, saying that you are able to have hands-on experience with real patients and able to handle the clinical environment. So I think it's good to either volunteer or get a very lightweight clinical job if you can. It's hard down here in San Diego. There's not many hospitals, but there are a lot of, senior centers and other places that hire medical assistants. So you can think about that too. The hospitals generally are willing to hire people that don't have an MA or a CNA license. If you go to the smaller places that don't have their own big insurance policies, they generally want you to have your own license, which is more difficult. And hospitals are always hiring. So if you can get in with one of those, that would be wonderful. If you can't do that, volunteer at some clinics every now and again. So there are, immunization clinics, there are health screenings for seniors or other underserved populations that are held all around, and you can go and get hands-on experience there. Beyond that, I would say, kind of let school be your focus, and it's over before you know it. You just need to pass. You don't need to get stellar grades. You just need to get the degree and pass the NCLEX. And it's tough. It's a really tough few years, but if you can do it financially, really just focus on school first above other things. Obviously, family comes before that, and if you practice faith, that probably comes before that too. But the other stuff, hanging out with friends, I had to sacrifice a lot of days with my family for sitting at my computer and writing papers. And it killed me for a while, but man, it was worth it. It was very worth it.
You so much for that. So you you mentioned about getting a CNA job and how that balance was. What do you suggest in terms of like um how that can like help nursing school?
It's tough. So your schedule with nursing school is generally set pretty far in advance. And so at your workplace, you can also get your schedule maybe like a month or two in advance and just set it to be on days when you don't have class, or set it on days right don't set it on days before you have a big exam, so just plan ahead. And I know that at our school we had a really good Google Calendar that they put all of our assignments and tests on for us, which is really nice. If you don't have that, make one yourself and just time box everything. So there's a system called time boxing where you work on something for a certain amount of time and then you stop. A lot of people have this psychological hill they have to climb in order to get something done, and setting an end time to things really helps accomplish that. So if you say, I only have 1 hour to write this paper, you'll write it in 1 hour. If I say I only have 2 hours to write this paper, you'll write it in 2 hours. It's a really weird phenomenon. So with the work and the assignments, just plan ahead and put it on a calendar where you can easily access it and see it and live by that thing. You have to be organized. And a lot of nursing school is proving that you can be organized. The workplace, once you become a nurse, is not any different. It's just faster paced. So you get 4 or 5 patients and you have to plan their day out right then, and you have to be organized with it and get stuff done. So it's really a difficult thing, but you have to prove that you can manage the work if you're going to take a job like that. And then you also have to have the wisdom to know when it's time to quit that job if it's interfering with your school, because that, again, has to come first. Does that answer your question?
Yes, that does. Thank you.
Okay.
And you also mentioned that you're in or you're going to critical care, correct?
Yeah, that's the
Yeah.
goal eventually. I have
So,
larger goals, but
so besides like CNA experience, like what other experience do you think that like can make you stand out like among other candidates, or like what can you do to like uh get more hands-on experience with those types of patients?
yeah, I briefly mentioned working at clinics or other things like that. So any type of project that you can work on, whether it's a research study or a professional association that you join that has volunteering, or your school goes on a missions trip somewhere for healthcare. Though anything like that makes you stand out. Anything above and beyond the curriculum that is handed to you by your school. And it's it shows that you have a passion for what you're doing, and it shows that you are willing to sacrifice your time to go and do something that helps people, frankly. I mean, and employers don't ask you to go above and beyond normally. And if they do, please ask them for more pay. But what they do like to see is people that are passionate about the field they're going into, right? And when you're a student, those are some ways you can prove it. So I'm a part of several professional associations, right? Sigma is one of them, the Nursing Society, and they had a symposium recently. So a bunch of the board members and a bunch of the members went and learned about research that's going on in nursing. And that's really important for progressing the career. And you could go to something like that too. Just go and sit and learn about what's happening in the field of nursing. And the important thing is then on your resume or in your interview, connecting that to what you want to do, connect the dots. So you can do a lot of cool stuff. Maybe it's just a beach cleanup or a holiday celebration. But when you go in and start talking about how you did that, make sure that you can explain how that's going to improve you as a nurse. Maybe it's just socialization with other nurses. Maybe it's networking out in the community of nurses. Maybe it's learning about research in a field that you enjoy. So we had at my work a stroke symposium where people talked about different initiatives for stroke. And at the Sigma Research Symposium, there was a doctor who came and talked about different screening tools for stroke patients. So it was really easy for me to say, hey, I learned about this. In my extracurriculars, went and watched a presentation about using a PHQ-9 form to screen stroke patients for their mental status. And my work loved it. They're like, wow, great. You're actually thinking about this. And it ended up helping me earn a position on a patient experience council, which is great for your career when you do things like that, because then, you're showing an interest and they take an interest in you. So stuff like that. And then just if you have problems figuring out what you can do or how you can connect it to where you want to go, talk to your mentor. Find a mentor, a professional mentor. Just be a friend. It can be someone at a workplace. It can be a clinical instructor. Befriend them and uh, ask them for help tying those things together. Professional organizations are a great place to start, by the way. They always have volunteering events.
Thank you so much for that.
Sure.
Also, one last thing, I also wanted
Mhm.
you to like expand like besides bedside nursing, because like that's what mainly we're all exposed to, especially in school. Like, can you expand on like what you've done outside of the bedside and like what is there like after BSN, what you can do in this field?
Yeah. I mean, that's one reason I love the profession is because there is just an unlimited amount of things you can do. And as a graduate nurse, you have a lot of freedom to improve the world in many, many ways. So I'm not sure if you had it, but we had a rotation called population health. And we would go to basically a building that was one of the universities down here where they would work on special projects. And we as students would volunteer. I mean, I guess we weren't volunteering. We were paying to be there because we were students, but we helped process whatever they were working on. So sometimes it was figuring out if people who left the emergency department had the right resources. So we'd call them and ask them medical questions, but then also like, hey, do you have the resources you need right now? Or talking to people who had high socioeconomic risk, right? And then figuring out if they had transportation to get to their doctor appointments, or sending out colorectal screening kits for people that were in this health system to make sure that the screenings were getting done correctly. Once you get into the graduate level of nursing, so like your MSN or even DNP or PhD beyond that, you have the ability to create these projects. You can go out and say, here's a problem in the world that I want to work on. Or here's a cool new thing I want to bring to the profession or to the world. And you can start that yourself with your license. And usually an employer or academic institution backing you, but it doesn't have to be. So literally you can do anything. One of the things I'm doing is figuring out how AI integrates into nursing as a profession and into healthcare, because it's a really hot topic right now. And I have a lot of experience in coding and software engineering and sort of integrations in technology. So that's going to be a challenge. It's going to be very rewarding, but it's only also going to be for a short period of my life. You know, it probably won't be my life's work. It'll be something that I can focus on for a while, do, and then move on to the next thing. And that's kind of the way I look at nursing as a profession. You know, I'm doing a rotation here. I'm doing a rotation as a step down nurse, and then I'm going to do a rotation as a NP, and then I'm going to do a rotation as a this or that, and then I'm going to work on this project. So there's so many things you can do. You can invent things to do, and if you get the right people behind you, you can do it, man. It's an amazing profession. Really, I would say follow what you're passionate about and find what makes your heart sing, what makes you go home happy that day. And for me, that's dealing with patients. So I really like bedside nursing because I get to talk to people. I really like step down nursing because the people are usually not sedated. So I get to talk to them and kind of understand them, meet their families, and hopefully provide some healing along the way. And if they go, you know, that was a good day, I liked where I'm at today, then I feel like then that really satisfied me. So find something that you love, and inevitably there will be a path in nursing where you can make that your career. There's everything under the sun.
Yes. Thank you so much for the overview of that, and thank you for answering all my questions and giving me like an overview of everything. Um, and that's sort of all the questions that I really had
Yeah.
for you today. Thank you so much.
One thing in wrapping up, I think one of
You're
the,
welcome.
the central themes that continued to come up was networking. And again, I can't say enough. We've got this cool group on apuconnect.com. What it does is once you're on there, you can reach out to anybody on the group. And so we have so many alumni like David that you can network with. He mentioned mentorship. And then I was even thinking we have a business directory, and we have so many alumni who have, just like David said, have created things. They saw a problem and they went to fit and fill a need. And we've got scads of alumni doing that, and lots of business entrepreneurs in our group. And I just get so pumped because I just want to introduce you to these really cool people doing really cool things. So if you have a dream in your heart, hold on to that, because I think that you can continue to make steps to achieve that dream.